So just let me say a word about who we will be in dialogue with for the next hour. Tana Ebbole is the Chief Executive Officer of the Children's Service Council in West Palm Beach County, Florida. And Tana will kill me for saying this, but go down and see what Tana is doing. Everybody here should be doing a site visit to West Palm Beach. Some of us have been lucky enough to see Tana's handiwork, but if you want to see an early care and learning system, a healthy whole child system being put in place in a very tough political environment, that's where you go to see it, and Tana has led that. Harold, yes. Harold did make a lot of trips. It had nothing to do with that condominium in Key Biscayne.
But we took advantage of that.
Exactly.
And took a lot of us with him.
That's true. Marianne Urquia, I have known for some years, first from Marianne's wonderful work at the Columbia Heights Shaw Collaborative, which I think you started, as well as being the director. So this panel is going to take an operator's perspective, or a on the ground. That doesn't mean that everybody is currently running programs, but everybody here has been thinking about how do you give guidance, how do you give support. Marianne has done that. On the strength of that work and others, she is now the Director of Program Strategies for Living Cities. So is worried about networks of communities that are trying to do this work and how to support them best. So the issues there of with what evidence do you support, how do you encourage innovation, many of the same issues we've been talking about. Ralph Smith, who is Executive Vice President at the Casey Foundation, a long-term colleague and who has been behind so many innovations and forward thinking that it would be difficult to count. But for the last number of years at Casey, among a huge portfolio, has been leading the place-based work that tries to put together the comprehensive strategies that Anne talked about in a way that is rigorous, that does have coherence, that does have a theory, and grappling with how do you help communities do that? What is the evidence base? Not just that you go in with, but as Raphael said, there isn't an evidence base there. So some of us who worked on that together worked a lot on how do you steer that, how do you have real-time learning that's part of that, and how do you harvest and distill the learning from that. And Ralph let me know that he's contesting the taking away of his title of the most coherent emails after 11:30 at night.
I am.
He also reminded me that there's a separate higher weight level category of most emails after 2:30 at night. He does have that one hands down, just for the record. And our facilitator is Prue Brown, who many of us have had the pleasure of reading her material. Prue is now an independent consultant, but if you look at the literature on a community change, if you look at the evaluations that we have all turned to, Prue is behind many of those. Prue and Leila Feaster, who is here, have written some of the most insightful material on that very complex topic. Has worked at Chapin Hall as a research fellow, was at Ford Foundation as the director of the Urban Poverty Program, so just has a wealth of experience. So Prue, I'll hand it over to you.
Okay, well, as Frank says, we're going to try to grapple with some of these implementation questions. We've actually already touched on a lot of them. And this kind of cross-sector, complex, evolving, long-term work inherently generates huge tensions that are for evaluators, for communities, for building knowledge. And we've, as I say, we've talked about some of them. Some of them have to do with changes in the environment that you have no control over. Mayors go to jail, school superintendents get fired, a foreclosure crisis hits, and you can't hold an intervention constant. You have to adapt to them. We've talked about how isolated programs, the debate really isn't about isolated programs anymore. It's about how do you collect a variety of programs, interventions, players, and bring them together in some way that aligns them around a shared goal and make some progress, the collective impact issue. We've talked about how there's a tension of evidence-based practice that may be perceived as externally introduced or imposed versus locally developed programs that have some collective ownership, and we know that that kind of ownership is necessary for sustainability, another inherent tension. And we've talked about the tension about limited resources. You have limited resources, you want to put a high percentage of them on the ground, there's pressures to do that, but who's going to pay for the data infrastructure, the evaluation and learning pieces, which often don't get paid for. So that's why we have this panel that's full of expertise and experience in dealing with these implementation questions. And the first thing we're going to do, kind of as Larry did in the last session, just ask everybody to introduce themselves and talk about, in a short amount of time, one or two challenges that they face around the question of evidence-based practice, and both in being informed by it and generating it. So I'll start with Tana.
Okay. Well, for some of you who may not know, I'm with a special district in Florida, and just by the statement of Florida alone, you should have some clue of the challenges we're facing. However, what I would like to focus on is the concept of evidence-based, data-driven, research-based, whatever language we want to use, and the belief that there is a one size or one solution concept. And the bottom line that we have found is there is not. That in fact we need to be operating in the context of an environment that is continuously learning, continuously adapting, continuously changing, but that work has to be grounded solidly in a data-driven approach. Mm-hmm. That data can be empirical, it's quantitative, qualitative, focus groups, a whole host of data that we bring together to help us look at and know where we're going and what we're doing. But at the end of the day, we're doing that with a specific purpose and a specific intent. And in our work, it is around ensuring that our children that we serve are born healthy, safe from abuse and neglect, ready for school, and on grade level at the end of third grade. So that we are organizing everything we do in those end goals. And therefore, if we said we were only going to use rigorously evaluated evidence-based programs, there are not enough of those to be able to get those goals. So that to say that is just plain foolish. Second, we have to develop homegrown programs. That's what we call homegrown. I have to tell you, my staff don't like me to use that term, but homegrown programs, and that's where innovation is coming in. But nonetheless, those programs have to operate with a good theory of change, mm-hmm. Implementation with fidelity, measuring their implementation to see, are they moving on a continuum towards becoming evidence-based? The third is that programs have to operate, and I would say programs and services, because I don't think it's just programs, have to operate in a context, and that context is systems. How is it that we're bringing them together, that they are working in synchronicity with each other? Because there is not a single solution, and families are complex and communities are complex. So how are we bringing those together, that they work in synchronicity so that our kids are born healthy, ready for school, and at the end of third grade? Now, The challenge in all of that is A, those concepts, but B, how do we even think about helping to create data systems at a program level even, much less at a system level? How do we talk about and think about evaluation? Because our homegrown programs, we're not going to be investing in a rigorous evaluation in the first 2, 3, 4, 5. They have to first prove they're worth that investment. Third, how do we operate this in an environment of individuals who, the previous panel talked about doing this work. We're dealing on the ground with people who don't even have an agency program data system. They're not even using data to manage their program. So it's changing a culture to think in terms of use of data. And third, even if they did, they don't really want to know in a way, because then they'd have to tell the funder, us, their program isn't working. Mm-hmm. And they don't want to do that, to going to your comment. So the third is changing the culture to be one that embraces learning, embraces solving problems, and embraces knowing that, like Edison, how many times did he fail before the light bulb? You have to keep at it, but you've got to have the data to keep moving it. So that's the work.
And I'm going to ask you more about how you build that capacity, but that's a great start. Okay, Marianne.
So ditto to all of that. So I won't cover that. I'll try to take it a little bit further or in a slightly different direction. So I am one of a new philanthropist who were critiqued up here earlier in the earlier panel. Hopefully a little bit smarter than the average new philanthropist about results, but we'll see. So in the role at Living Cities, I'm a national funder working on behalf of our members who are foundations and financial institutions. And there's two major areas lenses through which I'm thinking about this paper and the conversation today. One is this work that we're doing on funding 5 cities around the country through something called the Integration Initiative to make measurable and significant results on some aspect of quality of life or quality of place for low-income people. That's not very tight, as you can tell. What we were really interested in was the development of what we call one-table cross-sector partnerships that are really able to problem solve together, be driven by data, be driven by the desire to have impact, and can work together across all kinds of boundaries. And the second one, which is the one I'm going to focus on for most of the comments this afternoon, is that we've been the national kind of funder and agitator for moving the Strive work from Cincinnati nationally, and you read about Strive in a couple of points in the paper. They call me the bossy cheerleader, and that has been my role, is to be really cheering, but also be nagging and nudging. And one of the things to nag and nudge about was how we were going to think about replication. And I actually don't really love the term replication, so have really pushed to think about Strive as a framework, not as a model, to think about adaptation, not replication, and really be rigorous about that distinction in terminology. So what I'm concerned with is, how do you develop contexts, whether they're communities or partnerships or networks of institution, that are driven by a desire to achieve results and a desire to discover and do what works. And that sounds in some ways like, how hard can that be? Like, don't you want to change something, and don't you want to do what works? But it turns out it's actually really hard, because the definition of results requires choices, and it requires letting go of some, and it requires picking up some, and it requires making a public statement that you're willing to be on the hook for a set of results. Like, you're making a public proclamation, and that turns out to be tougher than you would think, because people are not used to doing that. They find it frightening, they find it intimidating, and they kind of use, in some sense, the lack of evidence and all the things we've been talking about. Sometimes this is a reason not to make those bold statements. The other piece, which is the discovering and doing what works, also turns out to be really hard, because there's a lot of embedded assumptions about what works, and people don't take kindly to the discovery process that what they thought worked didn't work. Yeah. And the other piece is that you are constantly moving. You're interrogating yourself, you're interrogating your practice, you're interrogating your impact, and that takes a different kind of management, it takes a different kind of leadership, and it really takes a different kind of culture, both for the individual providers and for the network of providers and for the larger leadership. The other piece that we're struggling with is, to borrow from Jim Shelton, is this navigation of the intersection between politics and evidence. And I've forgotten this, but I remembered it as the last panel was speaking. When I was at the collaborative, we had a Weed and Seed grant, which is a standard Department of Justice kind of community engagement around public safety grant. And one of the requirements for having the Weed and Seed grant, I think just in DC, it was like the prerogative of the U.S. attorney in DC, was that every Weed and Seed site had to set aside some of its money to send kids to DARE, which we know, and even knew 10 years ago, doesn't work. And it drove me crazy every year. And my staff was always really afraid that I was going to give back the grant, you know. And really, every year I was tempted to give back the grant, and every year it was an occasion. We had it for, I think, 8 of the 12 years I was there. Every year we'd have the conversation. I'd have the conversation with the U.S. Attorney's folks that, you know, this doesn't work. There's actually evidence that it doesn't work. We don't have that much evidence about things that absolutely don't work. So why are we doing this? And the politics, small p and big P, right? It's the U.S. Attorney's Office who really likes this program and who's controlling your overall funding and therefore is telling you have to do this thing. And then the small p politics around how do you navigate the role and the tension really got in the way. And every year, I'm embarrassed to say, I think, you know, if there's a heaven, this will be on the account. Every year I signed and we did DARE, fully knowing it didn't work. Another example of the kind of politics that you have to navigate, maybe slightly more subtle, but not that much more subtle. I was just in Seattle, and I was speaking with someone who wanted to disaggregate a set of very important data from a public system, which shall not be named, because I just remember this is streaming. So, and I said Seattle, so let me trying to make it anonymous as we go. Anyway, so she wanted to get disaggregated data coming from a set of school systems into this larger institution. And she was told that she couldn't have that disaggregated data because they had a signed agreement to not ever share the disaggregated data because they didn't want anybody to look bad, right? They didn't want to embarrass anyone. They didn't want to expose them to further criticism. And so they had signed that they, as the larger institution, could get the data, but that they would never reveal it except aggregated, which, you know, is not really legal. So you could file a FOIA, which was immediately where I went. I was like, did you tell them you could file a FOIA? And she didn't, because she's much smarter than I am and lives there, and so had to think about preserving the relationships. And so she had to go back to the individual superintendents and get them to sign so that she could get the data disaggregated. And so when we talk about building evidence and figuring out what works, there's all kinds of stuff that we have to navigate in these systems and these efforts that we're trying to develop. And so that's what I've been thinking about, and I think, hope that we can unpack more.
Yep, good, okay.
And so in many cases, when we think and talk about evidence from the standpoint of the communities in which we try to do this comprehensive change, one of the realities is folks who live there know that evidence doesn't always matter. And in this decontextualized conversation, we can persuade each other, and I was grateful to Lee for pointing out at the very beginning that evidence doesn't always matter. And we live in a society where some people don't believe in science, so why should they believe in evidence? Two, even when evidence matters, it is possible to make a couple of conjectures about it that really ought to be confronted if we're going to really live, if we're going to talk to the people who live and work in these communities. You know, what if evidence is less the public health model and more of a cancer treating model? Suppose what works is a cocktail. And that this cocktail is a combination of some things that have a lot of evidence, some things that have less evidence, and some things that may have no evidence at all, and is the combination and the synergy produced by the combination which essentially leads to the effect. Based on how we think about evidence, we will never get the low evidence or the no evidence into that cocktail. You know, and those folks who understand the power of a cocktail in treating cancer now know that evidence ought not to matter quite so much as to take some things off the table, because some things that by themselves were woefully ineffective have become enormously important. Thirdly, suppose that what if what works and what works well is, in fact, something that was developed for a wholly different purpose, and that what works is the unintended and sometimes perverse consequence of another effort. DARE, for example. What do we do then? And who invests in the reverse engineering if we have a threshold standard for evidence? We'll never invest in reverse engineering because we will say it worked by accident and not by design. And my good friend Sam Gary, who is an oil man, he says, you know, Ralph, every time I drill a well, I have got lots of evidence. He says, we have done the geological surveys, he says, nowadays we even have satellites, photos, telling us there's oil there. And he says, most of the holes I drill are dry. So sometimes the evidence is just plain wrong. What do we do then? And you know, confronting these questions is a really important reality for those of us who try to work in communities where people are rightly skeptical and rightly cynical. And it may well be that part of the challenge is that our dissatisfaction has to do because we're burdening evidence with the responsibility of substituting for political will, resolving ideological contests, operating in environment of conflicting and competing values. And this might not be the strong suit for evidence. You know, and it may very well be that the dissatisfaction is less about the evidence than the inadequacy of the tools, financial tools, analytical tools, conceptual tools, the non-availability of public will. There may be a lot of other things going on. So part of the challenge I think we have when we talk about evidence is to acknowledge that evidence may be like seniority. You know? Evidence is just something we need so that people could be comfortable that you're not making decisions that are arbitrary and capricious. And like seniority, there are times when evidence may outlive its usefulness. And we've got to be willing to say maybe there's a better way of making sure that decisions aren't arbitrary and capricious. And you know, there's a whole technology around crowdsourcing. That it may very well be that there are market mechanisms which allow decisions to be made and to be made in more anonymous ways that may not be subject to something being arbitrary and capricious. It may be what we now know about behavioral economics could tell us that evidence doesn't matter that much on either side of the table. People act against their own interest all the time for reasons that we're just now beginning to understand. And maybe what we're really trying to figure out is how to build knowledge and how to say maybe knowledge is not just what's produced in the academy and not what's produced in terms of research. Knowledge is in part listening to the voices of the practitioners as they engage in reflective practice, and lastly, listening to the voices of the folks who live, work, and worship in these communities and finding ways to access them. And if anybody leaves here without talking to Phyllis Brunson about customer satisfaction, you would have missed something really important. Anyway,
well, that's a very good, let's not talk about evidence. Let's talk about learning. Yeah. Learning and improving practice and building knowledge. So, because so much of this work is about learning and doing, trying something out, extracting information from it, using that to improve your practice, trying something else. And we've begun, you all talked about changes in the importance of management, changes of culture, building that learning in. And I think we've begun to do that through performance management, other strategies for individual programs, but I want to hear about that. But how do you build the capacity of an enterprise to do that? And then how internally, and then how do you aggregate up so that you can take the learning from from your shop and you can understand it and use it. We don't yet have that ability. We're just beginning to get the internal ability to improve our practice. But so can you just talk a little bit about the learning and doing cycle and the change of culture that is required when you try to do this?
You go, I'll go.
Okay, so it's a slightly different example that I have learned from the Strive work. So just give the example of their College Success Network, right? So they had a College Success Network, which was all of the groups in their region that were working on high school completion and college enrollment and success. And using what the method they use is a Six Sigma process that General Electric adapted for the social sector for Strive, and that's the methodology they use to walk their networks through assessing what they're doing, how it's working, and what they should modify. So the first thing they noticed was that the measure they had was high school graduation. Now, if you're doing college success, that's an insufficient measure. It's not a valid measure. And when they dug in their session, it was because they couldn't get the data that they needed to do the college piece. So they solved that issue. They also found that they were putting a lot of effort into college trips, right, to go to visit colleges. But when they looked at their data, meaning their end sample was the students that they had worked with in all the different programs, they found that college success didn't correlate, that college trips didn't correlate with the success. Instead, what they found that correlated was working on applying for scholarships, taking college entrance exam, actually applying to college, and completing the FAFSA. So they could see that from their data. So they were analyzing their data. And there was a lot of emotional attachment to doing the college trips. And so they had to say, that's actually not primary. It's nice to do, but it's not necessary because it's not contributing to the core result. We could get one of our church partners to do that, but we, the more specialized group, doesn't have to do that. And so then based on the data, right, where they were analyzing where they were having success, what were they doing with the particular students that were having success, what dosage were they getting of what, and then trying to shift everything to what works, right? So what they were showing and knowing worked in their network, right? So the positive deviance in some sense, and then making that standard. And it's that process, I think, of embedding that rigor of analysis, that rigor of discovery, and then that commitment to follow the data wherever it leads, which I think is a Casey Ralph phrase, yeah. And then really being accountable to then to really replacing and evolving to that direction.
Mm-hmm. Okay. And I think we've been hijacked by the term evidence-based, because I think it really is where what you're describing is more talking around data-driven. Everything that Ralph talked about was around having knowledge and data and information. It was all about, at multiple levels, having knowledge, having data, information that translates into knowledge and information you can do something with, to do something better, to improve, and that you're constantly changing. Because what you're describing, Miriam, is taken out of the Toyota way or other lean approaches. If we go to the business sector, they've used it for a profit construct. Right. But what we're really thinking about is our profit is changing the outcomes for our kids. But how is it that we are clearly articulating it, measuring it, changing as we measure and learn? Because if what works today is not going to work tomorrow. People change, it evolves. So I think moving and thinking more from that perspective, I think will be very helpful for us. That is around being data-driven, using data to inform and take you to the next place, the next solution, the next iteration of the work, and it becomes operational from the Strive at a program level,
and then moving up
and then moving up to how do you bring that all together at a system level? And there's other information that's going to come in at a system level that is separate than the program, but that has to come together. So how do we think about that? And the opportunity and the challenge is we have provided funding to most nonprofits, who are the people who are doing this work, through a competitive bid process. Now, if it's a competitive bid process, our whole funding systems are setting up that this won't be effective because they don't want you to know that their program isn't working. Number one. Number two, if we're really talking about systems, everybody in there has to be there for the long haul. So that if we've got 28, I'll just use this as an example, we have 20 agencies working together to achieve children good birth outcomes and reducing abuse and neglect between birth and 5. And they think they're competing against each other for the money. They're not going to be too eager to show that their data is not really too good, but they're getting a lot of clients because they're nice to the people, they give them food when they come in, but no, nothing's happening that we know of, intended or non. So we really need to rethink that whole funding system. And what we've done for that is said, you're not going to be defunded if your program isn't working. Mm-hmm. Instead, we are committed to you, Happy Children's Agency, and if your program isn't working, you're still going to have our money. But these are the conditions. A, you have to have had good data, submitted data, evaluated, been able to tell us what's working and not working. And if it isn't working together, we'll adjust, modify, or consciously abandon and find something else that you think will work or we think will work, and you'll be implementing it. We won't put it out to bid. So that people are part of the solution in this, and they're not competing against their fellow colleague or agency for that dollar, so that you're coming in at the beginning. Now, I can tell you as a government entity, this is a challenging thing to do because as a government entity, they want everybody wants everything to be open bid, competitive every 3 years. We don't do that. We're not going there because we have to change that concept.
And let me turn to Ralph and say, since you have such experience in philanthropy, what can philanthropy do to change that culture and promote learning rather than, you're on or you're off?
This is usually the time when I turn to Frank Farrer, but there are a couple of things. For those of you who had a chance to watch Charlie Rose last night, and if you were up waiting for that 11:30 midnight message, you would have seen Charlie Rose. He had the president and CEO of Ford Motor Company on last night. And he told this story about in 2007, after he'd been there a year, they had this huge meeting talking about the goals and everything else. And everybody reported how well things were going. And then he says, wait a minute, if things are going so well, why is it that we've got a $17 billion deficit? And he said it took him a while before that culture changed, but the most important thing about it is, one, the clarity about the result.
Right.
The clarity of the result transforms the conversation.
Right. And
quite often, we are unclear about the problem we're trying to solve and the result we're trying to achieve. The second thing is, can you build a sort of an intentional system? And philanthropy ought to be supporting the building of intentional systems for learning. And this is really what Frank's genius here was to create a series of revolving tables where folks were able to sit around the table, share experiences, both in role-alike tables and then differentiated tables, share their experiences. What is it they were learning in real time about the work they were doing? And what did that say about what adjustments and modifications and in-course corrections needed to be made in order to head toward those results? And then having the famous dashboards to report on the progress toward the results. And one of the things I think both Frank and I learned from our board, and it's really the UPS learning, is the purpose of that dashboard was really about improvement. It was to manage by data.
Exactly.
So, you know, they would go immediately to where the arrows pointed down or where the arrows were flat. And we first got into those meetings, and there's some degree of pride in your work, and so when you reporting that arrows are flat, you're feeling as if the criticism is about to come. And it took us a while before we understood. The reason why they keyed in there wasn't for purpose of criticism, was because continuous improvement was really about moving the bottom third.
Right.
It wasn't cutting off the bottom third, it was moving the bottom third. So this notion of having a clear result, having a set of processes that sometimes would take disaggregated knowledge and tacit knowledge and hidden knowledge and embarrass and making it and make it more explicit. Sometimes it's crime stat, ComStat. There are lots of models around the country. And then having a mechanism which allows you to make the performance visible and therefore able to attack the performance. This combination, I think, was enormously helpful to the work we did. It didn't promise or deliver perfection, but it was enormously helpful in moving us in the right direction.
Okay, that's very helpful. I'm going to open it up to questions now because we're on the home stretch here. Who has a question for our esteemed panelists?
I have a couple questions and a couple comments, but since it's late, I'm only going to drill it down to one. I guess prior to joining Casey in February, all my work was in community-based participatory research. It's pretty much what I did. And in last fall, I did a series of workshops for Robert Wood Johnson's Foundation's Local Funding Partners program. And it was 2 workshops on empowerment evaluation, like 101. And what was real clear is that the local funding partners were just as clueless as the philanthropists who were funding them regarding what evaluation was. So we talk about capacity building as if it's not our own capacity building as philanthropists. And then I think this meeting is part of getting some clarity on it. So that's one issue I think is huge. Like there's, and part of the capacity building I think for philanthropy is language. Even in the language used here, evaluation should never be if you're right or wrong. So we're using kind of causal language to really measure something that should be on a path model. So if you're looking at path models, you're looking at what contributions the different variables make to an outcome. So it's interesting to think about implementation, and I think part of the skill of it, our own capacity, is to step outside of our own bubbles and get into what does it actually mean, right? So, and the last thing is a kind of a comment. Well, I think the first thing was a comment too. But this idea that the things we're measuring are not linear.
That's right.
And that's what screws us up.
Yeah.
Right. So we think about if I put my researcher hat on, kind of multimodal designs, all kinds of designs that look at various types of contributions that different variables, both latent and those that are non-latent, make to addressing an issue. So I think that's kind of the researcher. We need to stop looking at what we're doing as a linear piece. Okay. And then the last thing is communities want effective. Right. They don't, and I think everybody wants effective. Right. And it's not always in the language we use around evidence. So I think that's a big thing for me.
Start from that. So let me start from the effective part. So I think for me, I think we're using evidence as a proxy in some way for effective and having a social return on investment, and so we can go to effective, so that would be the first. And I agree with your piece around needing to build the capacity and the kind of literacy and fluency in evaluation, and even in understanding how change happens or how transformation happens. So I'll give you an example. Let me just say this, that the other piece for me is that it's, as much as it is about evidence, it's understanding underlying mechanisms. And so even in science, right, if I'm going to my allergist, have an appointment next Friday, she's been very curious about what's the underlying mechanism of your allergic reaction. And what I learned when I was at the collaborative is that when I introduced the notion of underlying need, unmet need, and attachment theory, that our practice changed, right? And it wasn't about a modality, it wasn't about evidence, it was about understanding a coherent theory about the underlying mechanisms that were driving much of what we were working with. And so using that lesson in the work with the integration initiative, I think that the underlying frame is we are dealing with complex systems. We are in the land of wicked complexity. Yeah. Here's how people think about wicked complexity, and let's think about what the kind of consequences of that are for how you do large-scale change, right? So that then the effort on the capacity building is how do we understand a kind of paradigm within which we're working and then adapt to that paradigm in concerted ways, but really leveling the playing ground by introducing what it is that we're working in, what are the underlying mechanisms of what we're working in.
Okay. You know, I think one of the, and I think everybody wants things to be effective. I guess the question is, what does that mean, even effective? And defining what we mean by results are all challenging in this. And I do think that I agree with what you're saying completely, that we've traditionally used evaluation to say you're in or you're out, you're right or you're wrong, as opposed to using evaluation and data to drive how to do something better and better and better, and moving it to the next iteration, the next improvement, so on and so forth. And so within that context, there is a whole nother body of work, and that is most of the people, I can speak for our agency, and that most of the people we bring on board and work in our agency have come from the field that is not used to doing this. So how we have to build the capacity and change the mindset of our own staff before we talk about moving even into communities. And so there's so many dominoes on this. But in some ways, I guess this is going to sound kind of peculiar, but in some ways I think the ball that we need to be chasing and the end goal we need to be chasing may be around how do we change the paradigm and the approach to the work. Mm-hmm. And what I mean by that is learn from Ford. Learn from that lean model. How are we restructuring and redoing the thinking of how we're approaching our work, being what our work needs to be, so that we are operating from that concept of unpacking why, asking the why, getting the data to support, constantly learning, constantly evolving to get to a result, as opposed to we keep operating in the construct of program, which is important, but until we change the paradigm and the construct of how we're thinking, how we're approaching the work, how we're unpacking and using data to translate it to knowledge and information, and getting all levels working with that, we're going to stay in the same place. So it's almost like making a totally different question to the field of what is our work. So.
Another question? Okay. All right. Yes.
So I think I'm going to go along with the mix of a little comments, little questions in between. Okay. And so it's interesting to me in this conversation, particularly about the funder's role, and in the context of cultural change. And so what has to happen in communities and in those organizations within communities and neighborhood groups, et cetera, within communities to bring about cultural change? It is, to me, the connection with capacity building that is then needed to bring about the cultural change. And so when we begin to look within communities around the change doesn't happen overnight, right? We talk about cultural change, but there are a whole bunch of elements that have to be present to bring about the cultural change, both in dosage as well as in scope and in depth. And so one of the questions is around the role of funders in bringing about that capacity change as a precursor or simultaneously then to help bring about community change.
Just because that's a great question, if your second question is something totally different, we're not going to have time for it. So,
okay, let me take, because it just connects a little bit, because part of the capacity building also then relates to the drive towards the use of data, and we talk about that, the capacity around what do you do with the data once you get it?
But that's what has to be part of the system. Part of what so I would argue that doing capacity building outside of the context of effort to solve a problem is not helpful.
No, it is not helpful.
And that the capacity building has to be built into the way that you're solving the problem and has to emerge from solving the problem. And I think we would probably all agree that the data is part of solving the problem. It's not an out there, over there. It's embedded in.
It is there. And so, Ralph, to your point about the cocktail about what works, I think it's also, I would like to take your cocktail a little further and say, what's the cocktail there in terms of the work in communities to begin to partners each contributing to that change in the community, and that we begin maybe to change the conversation from attribution to contribution. And so how can various partners, organizations, begin to look at what they're doing within their entity to contribute to that overall community change, and how we begin to then bring the data together to say, before we were working this way, our culture, our capacity was at this level, we've now begun to shift, we've put in programs into place. I loved your conversation in terms of working with programs around not the punitive approach, that when you haven't met those targets, but how do we build capacity to get you to do that or to use what works. And so I would just like to hear a little bit more of, if you think that being able to shift this dialogue more to contributions and being able to talk about and name those contributions to that level of community change versus always getting people so hung up with the attribution, which is part of the conversation stopper with evaluators.
A decade from now, Lee Shore will persuade Frank to write the next iteration, and will be a critique of the merits and drawbacks of collective impact. But what the collective impact conversation does that is helpful, it takes us another step forward. It isn't the magic pill, it's not a panacea, but it takes us another step forward by suggesting, as my good friend B.J. Walker says, that we can each play in our lanes. That we could cooperate and collaborate, bring our respective resources and talents and points of view to the table if there's coherent leadership and if there is a consensus around a shared objective. And I think we can see that the work that we've been doing for the past 2 decades, we can see that work advancing with the conceptual shift that collective impact brings. And I think the collective impact work is enormously sensitive to building capacity across the board in an overview. So I'm optimistic that we are witnessing the next step forward, and that we'll be able to learn a lot from it as we go forward. And Lee, I'm counting on you to have that paper done. At this time, take about 6 months. Will you? That's time.
Well, I like the note of optimism, and I think that's where we're going to end. And everybody could just make a final comment in that
Right.
light of where we're going forward in a.
Well, so I've been really taken by the work of Charles Glisson at UT Knoxville, which many of you may know, who's really, I think, arguing that the context of organizations, the culture of organizations and kind of systems actually makes a difference for outcomes. So when we talk about capacity, it's not a enabler and an out there or nice to have. It actually really capacitates the transformation of the interventions we're trying to roll out. And so I think as funders paying more attention to what are the ways in which you build that baseline capacity of availability, responsiveness, continuity, and that kind of leadership, I think that's part of where we need to go, because collective impact is great, but it doesn't let anybody off the hook for doing their piece as well as it can be done. Otherwise, it doesn't roll up to big results. And I think that it's that fine line between accountability of the components, commitment to the larger whole, and the kind of dance between them that I think we have to figure out.
Great, thank you.
And kind of building on that, you know, I think we have to be able to operate and allow ourselves to operate on multiple levels simultaneously. And that's a challenge for many of us to do. But it is, each component has to be successful and effective into themselves for the collective to succeed, and there has to be a management of the collective as well as the part. And that is a hard construct to put together. But I actually think there's three things at work that to me give me a great sense of hope and opportunity. The first is that I think the best thing that ever happened to us is this argument about evidence-based. Because we are moving to a conversation that is talking about data, knowledge, information, and actually figuring out how to get results. So as painful as some of this is, it drives us to changing our conversations and moving us further, even in that mishigash of it all being messed up and feeling confused. And I think that's very healthy. The second thing is that I think the pressure of this current environment to say, we are tired of things not being effective or not getting results is a wonderful backdrop for us to motivate us to have a sense of urgency about this that I'm not sure that we really had. I think we've said we had it, but I don't know that we did. And the third is I am encountering and working with some of the most talented young people, middle-aged people, and older people that are starting to coalesce and come together to really think in a different way and try to operate in a different way, like the people that have been on these panels. And so I think that we're at a wonderfully exciting time. And how do we grasp that? And how do we bring that together to really help us move forward?
You know, as we see the power of technology being employed by ordinary people around the world to take control of their own lives, their own politics, and to transform the opportunity and political structures of their countries, one might want to speculate about the potential for the work we're doing if we actually found a way to use technology to enable the voices of the folks we purport to represent. And I know that might be a scary thought to a whole lot of us. But we do have, I think, we're on the threshold of a whole new way of thinking about issues, looking at issues, and hearing from those who are most affected by issues. And I do think it is quite possible that aside from creating an environment where folk can make more informed decisions, that evidence, if we don't figure out how evidence is used for the purpose of learning and helping people make more informed decisions, then it may very well be that evidence doesn't matter.
That's true.
Okay. thank our panelists here. It was very